Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this Thursday afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. A welcome to the media who are in attendance today. We have a number of you already on board, already submitting questions. But a reminder that if you haven't submitted a question, you can do so by clicking on the text bubble with the question mark here on Microsoft Teams, indicating your name as well as your media outlet and who your question is for. And finally, a welcome to the viewers and listeners tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. First, I'd like to thank the thousands of Londoners who responded to last weekend's grotesque act of hatred with their own overwhelming show of love, empathy, and solidarity. The grieving process will continue, and difficult conversations must be had before the healing process can truly begin. The outpouring we've seen over the last several days has filled me with confidence that Londoners are ready to have those conversations, and that we stand ready to take the necessary action to restore a sense of security, along with humanity and dignity for all Londoners. Once again, from my heart, thank you. Together we will grieve, and together our hearts will mend. Unlike earlier this week, I'd like to use some of my time this afternoon to speak about our efforts against COVID, specifically addressing our COVID vaccine shortfall. You'll remember last week we received commitments from the province for an additional 2,000 doses over and above our usual allotment, followed by an extra 3,000 doses this week. I term that as a good start and a show of good faith that the province understands the need to address our vaccine deficit. I also pledged that those conversations would continue. Along that line, I spoke directly with Premier Doug Ford this morning, and he was extremely understanding and receptive to the needs here in London, Middlesex. I can appreciate the desire to provide second doses for hotspots elsewhere in Ontario, but I was clear that our region absolutely cannot be left behind. The Premier, to his credit, was in full agreement, and thanks to millions of additional Moderna doses expected this month, the Premier anticipates London should be able to deal with its vaccine deficit in very short order, likely within a few weeks. That's hugely significant for anyone still in need of a first shot, as well as those looking to bump up their appointment date for their second shot. The timing is also critical, especially as London Middlesex, along with the rest of Ontario, enters into step one of the roadmap to reopen first thing tomorrow. All of us want to be this to be the final, and I mean final, lockdown associated with COVID. But to do that, we have to ensure that we get as many shots in arms and as many second doses into those arms as we can. The commitment I received from the Premier this morning gives me confidence that this will be the case, and I'm grateful for his willingness to listen and to act on behalf of us in London Middlesex. That's it for me. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. I'm going to start with the conversation about racism and Islamophobia, and particularly identify the large gathering of people of all shapes and sizes and backgrounds in support of the Afzal family and the Muslim community that happened this week. Mr. Mayor, you of course represented the city there along with your council colleagues and spoke eloquently about the importance of standing with our Muslim neighbors and friends against racism. There was a survey in 2016 conducted by Forum Research, which is a national Canadian survey organization. And they found that 41% of Canadians had some level of bias identified against a racial group. The largest number was 28% having negative assessments of Muslim people. In the following year, in 2017, Radio-Canada conducted a national survey and found that 51% of Canadians felt that Muslims being in this country were somewhat, made them somewhat or very worried about the security. We have a serious issue in our country around Islamophobia. It's not an isolated situation, although we hope this sort of situation never happens again. Even if it doesn't, we still have significant bias, some that is identified, some that is latent that we don't even understand our own biases. We also have a major issue with understanding, what it means to be Muslim, understanding the religion of Islam, and the focus that, as with most religions, the vast majority of people take, which is around peace and peaceful coexistence. I know that, public health doesn't have the answers to those problems. They are truly issues that we have to wrestle with as a society, and issues that, lay bare in front of us some of the challenges that our society has because of the inequities and inequalities of economic power, as well as many other forms of power in our society. And until and unless those underlying issues are addressed, we will continue to see significant amounts of racism. The Board of Health of the Middlesex-London Health Unit identified racism as a public health crisis last summer. And of course, Islamophobia is among the most important components of that public health crisis. To the COVID picture, we have had significant positive developments lately. Locally, just 20 cases yesterday, 22 the day before. These aren't the single digits that we saw over the weekend, but they are very good news compared to where we were at previous weeks and in the midweek period. No deaths recently, which is also very positive. The vaccine campaign continues intensely. We rolled out almost 4,000 doses yesterday, which has become almost our daily average over the last week or so, with the increased delivery that the mayor mentioned of 3,000 additional doses of of Moderna on top of our Pfizer deliveries this week. There are a few things that we do want to talk about on the vaccine campaign itself today. First of all, right now we have a walk-in clinic at City Plaza in the health unit offices. That clinic has appointments available between now and 4 p.m. today. So if folks haven't got their first dose of their COVID vaccine, they can go down to City Plaza right now and get doses. Second, the City Plaza clinic is an example of how we want and need to be out more in the community in more places. And for that purpose, we've put out an urgent call to our community right now for people that have management or supervisor experience in healthcare to come help us lead those mobile teams that will be doing the community-based clinics. We also have a need for more vaccinators, and we've put the call out there as well. You can see the health units, Middlesex-London Health Unit's social media channels for the details on that information. And we've also put a press release out, so you should have all of those details in your inboxes as well if you're viewing this from the media perspective. The summer weather has put some pressure on our temporary staff pool. Obviously, people have other things on their minds right now this time of year. So we really need to increase our pool of vaccinators and major gaps in the supervisor and manager level that we've been trying for some time to fill and had some difficulty. One thing that we want to flag, we're very open to, is temporary secondments. We know that people in management roles aren't necessarily interested in a 4 or 6 month contract, but we can work with your home employer on a secondment if that's something that you would be interested in. And that mobile aspect is a huge part of our campaign. I mean, you really need that to take off right now. Dan, I'll pause there. Happy to take any questions.
Thank you very much, Dr. Mackie, and to the media in attendance this afternoon. Now would be a good time to submit those questions. Just click on the text bubble with the question mark, and if you could indicate your name as well as your media outlet and who your question is for. We only have a few questions in the queue, so consider yourselves advised. Let's go to those questions right away, and we'll start with the first. This is a question for both Dr. Mackie and Mayor Holder. and it has to do with an announcement from the province this afternoon. How concerned are the province's newly announced Delta hotspot strategies for fast-track second doses? How concerned are you that this will put London even further behind? Who would like to answer that one first? Mayor Holder.
Well, why don't I start, because it certainly ties into some of my earlier comments today. Firstly, I understand the need to deal with hotspot areas, and the Delta variant is so fast spreading that the impacts are deep, and the potential for transmission and sharing of this variant is much more readily possible. But I will say I will rely on the Premier and his confidence in receiving significant doses. As I've indicated, we will be receiving as a country I think it's 7 million doses of Moderna this week, and ongoing Pfizer vaccines in the coming weeks, right through to the end of August. Dr. Mackie can respond more to that. But the Premier was very cognizant of London's situation. I say London, and I say London Middlesex, and acknowledged the contributions that we made when earlier, some weeks ago, some of our vaccine, some 20,000 doses, was diverted to the hotspot areas. And from my perspective, I look at this, and I will take the Premier's confidence that London will not be left behind in this process. And this was an important discussion I had with him, one that I have fairly regularly, and I would believe that over the next number of weeks that you will see that London will not be disadvantaged as a result of that. And I look to working with the Premier to ensure that that happens. But I say with the Premier, ultimately that works through the Medical Officer of Health of Ontario and then distributed through, but I'll leave it for Chris to make other comments.
Thank you, Mr. Mayor. I think we're very much aligned. The main question is how aggressive will the reallocation of vaccines to the Delta hotspots be? If this is, we have millions of doses of Moderna coming in. If all of those get put towards a hotspot strategy, then I think it really does leave our region at risk of falling further behind and potentially becoming a Delta variant hotspot. We've had at least one case so far. But if there's a balance, I certainly understand the need for second doses to help prevent the Delta variant expanding, and we completely support that. It's just, we are behind in first doses as well as second doses compared to communities that were previously designated hotspots. The other thing we don't have all the information on, not just how much, but where the vaccines will be going. And is this a hotspot strategy that is defined once and then not revisited and updated as new hotspots emerge? That would be a potential risk as well. So very hopeful with the new vaccines coming in that the distribution will be balanced. We don't have all the details at this point.
Mayor Holder?
Yeah, I just want to add that I made it clear to the Premier when we discussed the issue of vaccine needs in London and Middlesex that right now, this past week, as a result of the additional doses, Dr. Mackie's indicated that we've been averaging this week about 4,000 doses a day, and that's significant. But I did indicate as well that we have capacity for some 10,000 deliverable doses if we had the vaccine, and he took note of that. And I'm reminded that when the Solicitor General just a number of days ago indicated that if a community can establish that they have capacity to deliver, and B, identify the need, that would be helpful in supporting the argument to get it into those places where it's needed most. And I certainly argue that London needs it desperately.
Thank you very much. Let's go to our next question. A follow-up from Jennifer Beeman for Dr. Mackie. Dr. Mackie, of the 3,500 or so daily appointments at mass vaccination centers, what proportion of those are second dose appointments? And what does this increase to in the coming weeks?
Yeah, it's a good question, Jennifer. It's in the range of 20% at this point that are second doses. Over the next few weeks, we still have primarily first doses booked, but there are, probably another 20% will start to move towards second doses by the end of the 4-week booking time period that we're in right now. So, that'll shift to maybe 60-40 by this time in July, and then continue to shift from there.
Thank you, Dr. Mackie. Andrew Graham has the next question. Andrew is joining us from Global News Radio, 980 CFPL. Dr. Mackie, how were things at today's walk-in clinic at City Plaza? You've mentioned that there's still space. Do you plan on doing more of these clinics downtown?
Yes, so downtown has been a major gap, and some of our vaccination clinics are fairly accessible by bus, so not too hard to get there. But we have a huge population downtown, and some people may not want to travel by bus in the current situation, and for others, travel may be a very difficult barrier. So we definitely plan to have more of these clinics downtown and in as many other areas as we can.
Thank you, Dr. Mackie. Next question is from Carrie McKee at CBC London. For Dr. Mackie, is the cancellation process resolved? We're getting calls from people saying they got a second dose elsewhere, and try as they may, they haven't been able to cancel their appointment for London.
Yeah, thanks for the question, Carrie. The website actually has a specific cancellation function now. So we believe that we've been able to resolve that. I certainly have heard that people who may have tried to cancel through the link in their appointment have had trouble. Definitely have heard that. And I don't have an answer on that particular question, but you can actually go straight to covidvaccinelm.ca, and there is a cancellation part of the portal there.
Thank you, Dr. Mackie. And I can add a little bit of detail on that. We are still working on making the cancellation portal that Dr. Mackie mentioned work for people who have booked multiple appointments or appointments for multiple people using the same email address. So we are working through that piece as quickly as we can. And we do thank you for your patience already. The number of calls in excess of 70,000 today to the booking phone number. Let's go to our next question, and it comes to us from Jane Sims. For Dr. Mackie. Dr. Mackie, it's obvious that this city is in shock and grieving. The focus has gone off the pandemic. Are you concerned about getting the community refocused on beating the virus?
Well, I mean, I think, we have a community in mourning, and that's entirely appropriate right now. The racism issue is a crisis in this community as well. And so I certainly don't see these as competing priorities. I think you can hold the Afzal family in your heart and also get your COVID vaccine and keep your distance. So hopefully these aren't things that really take away from each other. There's a lot of similarities in the issue. We know that people who have, who are from visible minority groups are at higher risk of developing COVID. We know that the vaccine hesitancy is somewhat higher in some of those groups as well, and that uptake has been challenging. It's part of our strategy, working with the Black community, working with the Indigenous community. We had a vaccination clinic in a facility attached to the mosque recently. So these are places where the specific outreach to connect with the communities is part of what we do to address COVID, but it's also part of what we do, to address racism and address the systemic barriers faced by many visible minorities in our community. We've had clinics. One of the first groups to come on board in terms of vaccination was SOHAC, the Aboriginal Health Access Center. We've had clinics at Namrand. We'll be going back there. We've had clinics on reserve. I mentioned the clinic that we did in partnership with the Muslim community, working with the Black community. The advice there has been mixed, whereas within Indigenous community, people wanted their own clinics. With the Black community, we've had different advice. So certainly that has come up as an option, but others have said that, we don't want to be segregated. We, wouldn't necessarily trust a clinic that was just for Black people. Would they be getting expired vaccine or whatever? So that isn't a route that we've taken with that community. Instead, what we've done is tried to make sure that our vaccination staff is as diverse as possible, that we're working with people in the Black community to get the message out about vaccines and about availability of appointments. So all sorts of different strategies that I think are very much aligned. And if we need to take time to mourn the loss of a family and the tragedy that happened, I think that's entirely appropriate.
Thank you, Dr. Mackie. Mayor Holder.
Just let me add, and thank you, Jane. I think yours is an important point. Our city is clearly grieving and coping with where they are today, how they come to terms with this absolutely horrific tragedy, and what they can do next. Some of the things they've been doing have been certainly within the Muslim community, and we saw at our vigil the other evening, a great coming together of, in that case, thousands of people. Police estimate it was upwards of 15,000 people, and the province gave a special legislative dispensation for that group to gather. I was moved by the community's efforts to keep self-distanced and the encouragement by the moderator to do that. But the reason I bring that up is that I also know tomorrow there will be a walk starting from the site of the accident, of this horrific incident. And because we anticipate there will be, again, a huge crowd, what we're encouraging people to do is, beyond obvious things like sensible footwear and bring water and the like, is to self-distance, wear your mask, the things that we've been promoting for the longest time. I don't think the issue of us as a community grieving the loss of this family and our need to get the shot, as Dr. Mackie's indicated, are mutually exclusive. Both are critically important to our community. And it's about the health, both the mental and the physical health of our citizens. So I know I speak for Dr. Mackie when I highly encourage Londoners who haven't gotten their shot to book it, and those who are eligible for their second shot to take it. If there's ever been a time when that's absolutely critical, it's now. If we want to consider the health of our community and all the aspects that we consider, I think taking your shot shows great respect for one another. And there's been an outpouring of that as a result of this sad situation where we care about each other. And what a great way to show we care about each other as well, as to get the shot.
Thank you very much, Mayor Holder. Thank you, Dr. Mackie. Folks, that does bring us to the end of our questions for this afternoon's virtual media briefing. We thank you for your participation and for being with us. We will be back with our next virtual media briefing on Monday afternoon at 2 p.m. So between now and next Monday, have a great rest of your day. Have a great weekend. We'll see you on Monday, and so long for now.